Hi, I'm Kristin Fontes, and I just finished a full CME accredited toxicology course with MidMastery, and I'm here to share with you 3 life-saving tips that you can use when caring for poison patients. Sometimes we aren't given all the information that we need, like when and how much of a substance was used, but just remember to start always with a good, thorough physical exam, and then use my top 3 interventions that will help you save a poison patient's life. The first one is activated charcoal. Now, this is a really powerful way to block even the most toxic orally ingested substances from getting out of the GI tract into the bloodstream. Fortunately, many patients present within an hour after their ingestion or their exposure, and this is the time frame in which we want to give activated charcoal. Charcoal will work for the vast majority of substances that are taken by mouth. It doesn't work for everything. So things like small polar molecules like alcohols or metals are not going to bind to charcoal at all. So you really can't use it for that. But for everything else, pretty much, as long as the patient is awake, they're able to listen to directions, follow commands, and you don't think they're at risk for aspirating, you really should offer charcoal as one of your treatments because it will save you a lot of time later on, and it will also prevent as much of that poison from getting into the patient's bloodstream as possible. Second, of all the antidotes out there, naloxone is the one that really has great diagnostic and therapeutic capabilities. So let's say you have a patient in front of you who is unresponsive and they're breathing very slowly, or they're not breathing at all. You should really give these patients a dose of naloxone. If they wake up and they start breathing normally again, not only have you just diagnosed an opioid syndrome, but you've also saved their life. If they don't respond at all, then you know that you've ruled out an opioid syndrome, and now you have to move on and figure out what exactly the diagnosis is. It is a great way to help you differentiate between different poisoning syndromes. So always consider naloxone when you're dealing with an unresponsive patient. The third life-saving tip is to make sure that you know when you're able to use dialysis to help remove a poison from the patient's bloodstream once it's already gotten there. It works for several different substances like lithium, salicylates, ethylene glycol, methanol. It's not appropriate for everything, but it is a really powerful tool if you're able to use it. Now, it is a treatment modality that does take some time to set up, and it does require the expertise of a kidney doctor. So if you're thinking that you're going to need dialysis for your patient, it's really important to call and ask for help as early as possible, because that really could mean the difference between life and death. And dialysis is actually something you can use even if you have an antidote for the poisoning. So make sure you feel comfortable and confident in approaching the poisoning syndromes and other conditions in which dialysis is a good treatment method. So now that we've talked about the 3 life-saving tips, make sure that with every intoxicated patient, especially those who are critically ill, that you are familiar with, comfortable, and confident in providing supportive care. Sometimes it has to be really aggressive supportive care too. So things that seem really simple and routine, like oxygen, intravenous fluids, sedatives, cooling measures, medications to support blood pressure and heart rate, all of these things are applicable to toxicology patients as well. Especially in cases where you have to wait for, say, dialysis or wait for an antidote to arrive, it really is important to administer supportive care whenever possible, and that is the case for every poison patient. Thanks so much for watching this video. If you found it helpful, subscribe to MidMastery and check out my full toxicology course. All right, now go out there and save some lives.